Hey everybody, we are live on Facebook. We're going to talk a little bit about repealing Obamacare. The one thing that's really united Republicans through the last 4 elections has been that we are for repealing, or so we say, we are for repealing Obamacare. We won the House, and then many people that were elected said, well, we can't do it yet because we have to win the Senate. So then we won the Senate, and the Republicans often said, well, we've got the House and the Senate, but we can't repeal Obamacare until we win the White House. So in November of last year, we won all 3 branches, the House, the Senate, and the White House. And we began serious debate for repealing Obamacare. Unfortunately, we discovered along the way that many Republicans really didn't want to repeal Obamacare. Many of them, in fact, want to keep Obamacare. So right now, we've been looking at something put forward by Senate Republican leadership. In this bill, it keeps more than half of the Obamacare taxes. It keeps most of the Obamacare subsidies. It keeps most of the Obamacare regulations. And one of my key objections, it creates an enormous insurance bailout superfund, $180 billion. The other problem I have is that fundamentally, I don't think we fix Obamacare. The fundamental flaw of Obamacare is this. You add regulations or mandates to insurance. These are things that get added on to insurance like pregnancy coverage, vision, dental, all things that we may want, but they cost money. So when you add these insurance mandates, as Obamacare did, it chases basically the young, healthy people out of the market. When the young, healthy people say insurance is too expensive, what happens is the insurance pool, the people buying insurance, gets sicker and sicker and more expensive. The fancy name for this is adverse selection, or you may have heard it on TV called the death spiral of Obama. So the death spiral of Obama is true, it is real, and what it is escalating, astronomical escalation of premiums. So if you're a plumber and you and your wife buy insurance, your insurance has doubled over the last couple of years under Obamacare. About half of the country only has one insurer now. There's a monopoly in insurance, and the prices always go up under a monopoly. And so you say to yourself, well, maybe the Republican bill will make that better. I wish I could tell you that, but the Republican bill actually keeps the death spiral of Obamacare. Still has the regulations, so the insurance is still going to be expensive, and it also still gives you the alternative of buying insurance after you're sick. Think about it this way. If you made $30,000 a year and your insurance costs $10,000, let's say you're single, but you make $30,000 a year and your insurance is going to cost $10,000. Nobody can afford to spend a third of their gross income on insurance. Sometimes it's not even deductible if you're buying your own insurance. And then the government says, oh, but the insurance companies can't charge you anymore if you wait till you're sick. Why would anybody want to buy insurance? That's what happens. That is the death spiral of Obamacare. It remains under the Republican plan. And so under the Republican plan, we still have the same death spiral. And so what does the Republican plan do? The Republican plan just simply says we're going to subsidize it. So there's a fund in there. I call it the Insurance Bailout Superfund, $180 billion. And this money, they say, oh, they'll lower prices. My response to them is, well, gosh, new cars cost a lot of money. We could have a new car stabilization fund, take $150 billion from taxpayers, put it into a government fund, and say we're going to pass it out to everybody who buys a car so their car will be less expensive. The problem with that is it's just not a very Republican or not a very conservative idea. It defies every principle of free markets, and it's not what we promised. We promised to repeal Obamacare. We didn't promise to create this massive insurance bailout superfund. So anyway, at this point, if that's what the Republican plan is, if the Republican plan is a massive bailout for insurance companies, I can't be for it. Now, one other alternative that's been floated is to have a clean repeal. And a clean repeal basically means no new government entitlements. We just repeal Obamacare. And there isn't a complete repeal out there, but there's a partial repeal. We voted on it in 2015. Every Republican senator except for one voted for it. Now we put it forward, and half a dozen Republicans say, oh, well, I voted for it in 2015, but I'm not going to vote for it now. This is the problem. Republicans have lost their nerve, their weak-kneed, and they're not willing to really vote to repeal Obamacare anymore. This is sad. We won 4 elections on it. We promised the voters we would repeal it. No one in America wants to repeal Obamacare more than I do. So I am going to vote to repeal it. If I can get a vote on a clean repeal, that's what I want. I was at the White House today talking to the president and saying, Mr. President, what we really want is a clean repeal. We don't want a massive federal bailout of the insurance companies. But that debate's still going on. We're going to find out next week. There will be a vote next week, and we're going to find out, is it a real repeal bill or is it a bailout of the insurance companies? With that, I think we'll take a few questions from Facebook.
Okay, we have one from David. The question is on repealing and replacing Obamacare. Is it necessary to replace it after repealing it? Why can't the free market establish a good medical system?
This is a good question. If you repeal it, what will happen? Well, if you repealed everything, all of the insurance mandates, and you let the free market operate, yes, the free market works in every other industry and would work perfectly. But here's the rub, and this is the real danger of getting involved with this and not fixing it. If you partially repeal Obamacare, if you only repeal some of the regulations, but you leave many of the mandates in place that increase the price of insurance, guess what? You've still got the death spiral of Obamacare. That's what my fear is. But yes, you could repeal the whole thing. That's what I've been for from the very beginning. Replace Obamacare with freedom, choice, competition, and have sufficient confidence in capitalism. What is capitalism? The freedom to sell to your neighbor what your neighbor will buy voluntarily. If you do that, Katie bar the door. We could have all kinds of great insurance at a cheap price in our country if you allowed freedom. So you're right, replace it with freedom, not with a new federal government program, with freedom. But you have to get rid of all of the Obamacare restraints, but realize the vast majority of Senate Republicans have capitulated. They're willing to keep most of the Obamacare regulations. And so if you do, you're going to end up with a mismatch, half Obamacare, half not, and you're going to have a disaster in the marketplace, and that's what I predict.
Another question is, will expanding HSAs be included in any replacement bill, and what would that do to healthcare?
One of the good things in the current bill is they do expand HSAs. They let you put more money away tax-free to save for your healthcare costs. And they do something that's also good. They're going to let some insurance policies deduct their premiums. Now, I would just let everybody deduct their premiums. Everybody in the individual market, anybody that buys insurance outside their company, I'd let them deduct it, the whole thing. Let them put their premiums, get the premiums out of their health savings account. What this bill does is, for a select few people who have HSA-specific insurance plans, you can. The good news might be that people will buy more HSA-specific ones so they can, participate in the HSAs. And it is a way to try to develop a true marketplace where if your deductible is a couple $1,000s and your insurance is cheap, then what you do is you will be concerned with prices and you'll ask the price of things.
Okay, next question is from Laura. Can you explain why people think we have to subsidize insurance companies and bail them out?
No, because I don't think we should bail out insurance companies. I can tell you why they have it in the bill, though. This is the big rub, and this is the most important part of why the Republican plan is not a good one. It retains the death spiral of Obamacare. It retains the concept that you can buy insurance after you're sick, and then it also retains the regulations that make insurance expensive. You have those two things together, what happens is you get adverse selection, the death spiral of Obamacare, premiums skyrocket, and people can't afford it. So what do they say? Oh, we're going to send money to the insurance companies that they'll promise to lower your rates. So the reason the insurance bailout fund is in there is because, believe it or not, the Republicans are going to keep the death spiral of Obamacare, and then they're going to subsidize it. So they don't fix the death spiral, they subsidize the death spiral. I'm completely against it. The insurance companies made $6 billion a year before Obamacare. They now make $15 billion a year, and I'm not going to pad their profits. That's just not a Republican or a conservative notion.
Next question is from Arlen. Why can't we have the same health care as Congress? Better yet, why don't you guys have our health care?
Unfortunately, we do have your health care. We do have Obamacare, and I hate it. My wife and I spend hours calling the insurance company saying, you know what? We want you to pay for the things you promised to pay for. So we have as much frustration as the rest of America with Obamacare, and I'm stuck with it, my family's stuck with it, and I sure wish I didn't have it, and I wish the rest of America didn't have to have it.
Next one's from Joe. What do you think it'll take to get 52 senators to repeal?
Well, we need to make them remember that they promised to repeal it. I think that if you're anywhere out in America and you have a Republican senator, call them up and say, you promised to repeal Obamacare. How come you won't vote for a clean repeal? And how come you're voting for this messy bill that's full of insurance bailouts? The only way you'll get it to happen, though, is if thousands and thousands of people called their senator and their congressman and said, I want you to vote for real repeal.
Next one is, can you explain the dangers of socialized medicine?
Yeah, the danger of socialized anything is that it doesn't distribute goods very well. What do I mean by that? If you have anything that the marketplace makes, shoes, clothes, eyeglasses, iPhones, you name it, if you want them to be distributed to the most amount of people at the least amount of cost, you have to allow the price to freely go up and down based on supply and demand. In socialism, somebody decides that it's going to be against the law to sell things unless it's owned by the government. In true socialism, the government owns all of the industries, and then they set the prices basically arbitrarily. And this is something that von Mises and Hayek and other people pointed to, Murray Rothbard, they pointed to and said, you know what? The reason socialism will fail is that if you don't have a marketplace and you don't allow supply and demand to intersect and people to freely exchange goods, you don't know what the best price is. So one of the things I've always said is that the Soviet Union collapsed not because of military might, but they really collapsed because they couldn't determine the price of bread because socialism doesn't work. So it doesn't work anywhere in an economy, but in particular something as important as your health care, I don't think you'd want the government to be in charge.
Next one is from Will, and it says, group purchasing is the greatest idea since sliced bread. Can you talk about your idea for association plans a little bit?
Yeah, I think that the fact that some people have to buy insurance in the individual market is wrong. I think it's an artifact of government policy. Back in World War II, they said insurance can be deductible if it comes from your employer. So big employers supply insurance, small employers sometimes don't, and if you work for yourself, you may not have insurance. And so what happened is the group insurance market, where you have a bunch of people buying insurance, you got the leverage to get lower price and better terms, meaning that you were protected against pre-existing conditions and things because your group was big enough to demand those things to be in your insurance. So what we wanted to do is to let every individual, whether you're a plumber or a welder or a carpenter, we want to let you get group insurance like they do at General Motors or Toyota or Ford. And so we think that that can happen if it's legalized. It doesn't cost any money. It's just the federal government saying, if you want to join a nationwide association, let's say it would be the credit unions, or let's say you're in a restaurant work, the restaurant association, or you're a retailers association. You could do all of these things and get a much better product. This is something I've been fighting for and something I'm trying to get included in the bill. Let's do maybe one more.
Okay. I'll do one more and then you can kind of wrap up. My concern is Medicaid. I have a disabled stepson who needs health care. What do you have to say about helping people with disabilities and poor people on Medicaid?
The interesting thing is that Obamacare's expansion of Medicare to able-bodied people actually takes precious resources away from the disabled. So if your child has cerebral palsy or autism or Down syndrome and they're on Medicaid, or let's say they're paralyzed and they're on Medicaid, when you add healthy-bodied people, people that can work and lift things and drive a car and all, they can do all the normal stuff and should be working, when you add them on Medicaid, they take away the precious resources from those who are truly disabled. So I would advise anybody out there in America, if you have a disabled family member and they're on Medicaid, you should be opposed to Medicaid expansion. You need to tell those able-bodied people that they need to get out there and work. There are lots of jobs available, and there's no reason why able-bodied people should be out there and work. I want to thank everybody for participating in this today. I think this is a big issue, maybe one of the biggest issues of the decade. And the real fundamental part of the issue is, should the government be in charge of your health care, or should you be in charge of your health care? Should free markets, free people make free decisions on what should be in their insurance, or should the government dictate this? You have to realize that when President Obama set this up, he set this up because he thought he was smarter than everyone else. He thought that he could make decisions, that his elite knowledge was so smart and that you were stupid, that Americans weren't smart enough to make their own decisions. This is at the crux of all big government solutions, is they think government knows better than you, and they're going to make these choices for you. President Obama said, if you like your doctor, you can keep it. If you like your insurance, you can keep it. It was all a lie. And the thing is, now you're stuck with this terribly expensive, dysfunctional insurance. I think we should scrap it all. I don't think the federal government should be involved in making any decisions for you on insurance. You should get to decide. We should let it go back to the states and the people and get rid of Obamacare completely. That's what I'm for. That's what I promised. And I wish the rest of my colleagues remember that that's what they promised.
We will make America great again.